Let's say you were driving down I-4 and you got broadsided by a drunk beer truck driver. You have a brain injury and you're out cold. You get airlifted to ORMC because it is the closest level 1 trauma unit. The neurosurgeon wants to give you immediate brain surgery to save your life. Who can consent to the surgery? You can't because you are unconscious. Please name a healthcare surrogate or multiple people in a row to be the person to make informed consent medical care decisions for you if you can't make them for yourself. Let's say you have that brain surgery and 3 days later you still are unconscious and you develop pneumonia. Who knows that you are allergic to penicillin? That's the person you want to name. Your healthcare surrogate should have the time to go to doctor's appointments with you if necessary, should know your medical conditions and your prescriptions, and must be willing to act on your behalf. Another common situation where a healthcare surrogate becomes invaluable is if you get dementia. Your healthcare surrogate may have to help you for years. There is a legal answer and a practical answer to medical care decisions. The practical answer is, if you are airlifted to a level 1 trauma unit and you need your neurosurgery to keep you alive, the physicians will operate on you without stopping to learn if you have a healthcare surrogate, and they will communicate with anyone who cares enough to show up at your bedside. However, if there is dissension amongst the troops, I once was called to help at the hospital when the first wife showed up and argued with the current third wife and the adult son of the second marriage. That's when the physician will ask, "Who's in charge here?" And the legal answer is the person you named in your healthcare surrogate document. You might want to name all of your children to act together so you don't hurt anyone's feelings. Or name your current spouse, who is not the parent of your adult children, together with your oldest daughter. Please reconsider. If everyone is getting along at your bedside, the legal document is not an issue. But if there are differences of opinion about your care and you have named multiple people to act together, you are setting up conflict and dissension, and that is not helpful. Also remember that the healthcare surrogate document is not the same as the pull-the-plug document, known as the living will. The healthcare surrogate makes medical care decisions to keep you alive because you are going to get better. You may choose to name the same person in your healthcare surrogate and living will documents, but the responsibilities are different in each role.